Good evening, and welcome to the Physician-to-Physician Forum for Plastic Surgeons with Dr. Michael Cash, a plastic surgeon in Nashville, Tennessee. My name is Emily Morta from Modernizing Medicine, and thank you all for joining us tonight. We'll start tonight's presentation with an overview of Dr. Cash's experience with emoplastic surgery, and we'll follow with a question and answer session. Please write in your questions at any time during the webinar in the questions section of GoToWebinar. We will do our best to answer all questions, but if for some reason we cannot get to them all, we will follow up with answers after the broadcast. It is my pleasure to introduce Dr. Michael Cash.
Good evening, everyone. I know you all are very busy, and hopefully you'll find this forum beneficial and useful for your time. Let me give you a little bit of background about myself. I finished training in 2012, and I stayed here in Nashville and was in private practice. Initially, I was in private practice with a single surgeon, and then ultimately transitioned out to on my own. My practice is varied in plastic surgery, including reconstruction and some cosmetic. The bulk of what I do is really reconstruction. And ultimately, through my transition out of that first practice, I looked into EMRs and ultimately settled on using EMA. So let me tell you a little bit about my past experience with the other EMR. You know, initially, when the EMRs kind of came about, many EMRs tried to be everything to everybody rather than being specific to a field in medicine. The EMR that we used when my first year in practice was really based more on an internal medicine ideal, and then you could modify that to work specifically for plastic surgery. But for me, that was very laborious. That took almost programming that to a different note type and whatnot, and into what our referring providers really wanted to hear about their patients. So that for us was very laborious, and even to the point that we didn't actually even apply for the meaningful use because we weren't even close to meeting it. So that was lost revenue on our part. Additionally, that EMR used a server and required IT services, so those were another cost out of our pocket. Not only did we have to buy the software, but then we had to have the server to back it up and pay for the updates and whatnot. So I really felt like that EMR really slowed me down, and that's been everybody's kind of concern from the get-go with an EMR. So after I transitioned out of that practice into solo practice, I initially was just kind of on paper while I was getting up and running, and that is also an inefficient use of time, and it's a difficult way to communicate back to referring providers. So for me, that wasn't a viable long-term option. I looked into a lot of EMRs when I was researching them, and for me, what I wanted was something that was mobile, something that was efficient, and something that I felt produced a clear, concise message to the referring providers that I would be sending this back to. And for me, EMA covered all those things. It's very mobile with the use of the iPad app, and I carry my iPad everywhere I go now, to the OR and whatnot, and then I have the pictures right there with me. Anytime I have access to Wi-Fi, I have my entire patient chart. I don't have to remotely log back into my computer back at the office or anything like that. It's very efficient for us in the office. I really have found that my notes are very quick to do in between patients. Even new consults for me don't take much time now that I'm very used to the whole process. The other thing that really is important, at least in plastic surgery, is pictures and before and afters, and as you go through expansion for breast reconstruction or whatnot. And it's nice to take those pictures. With Emma, you take them and it imports them directly into the note for that visit. And again, that's a really nice way to communicate back to the referring provider. I liked the fact that it didn't have a server. It's a monthly fee basically, and all the updates are included, and I don't have to pay for a IT guy to service our server, and a $5,000 server, and on and on and on. So let me. I guess the other thing I wanted to say is that the way for us, we use it as kind of an all-inclusive tool, and everybody in the office uses a certain part of it, and we'll get into how we use that in a little bit. But the specific things in Emma that were great for us and selling points were the pictures. We're able to put our consents in each note. We can put the orders for the surgery, which I can communicate to my nurse. I can email within the system back to anybody in my staff. The path is imported in there, and I can check that off. And then it's easy to fax it to the referring providers as well. The other thing I should mention is that we use a separate billing and scheduling software, and it works seamlessly with that. And that was a real selling point for us too. And we had no problem with that implementation. So let me talk a little bit about the implementation process. With all of my patient data from the previous practice, Emma basically took that through our billing software and imported that directly into their software, and so it was already uploaded for me. I didn't have to do anything. That was really a seamless process, and that was very efficient. They did that in a very timely fashion, and I didn't have to lose any sleep about that at all. The other thing that in that process of transition, they really guided us very specifically on how to do each note. The training was very in-depth, and at the same time, I didn't feel like it was too lengthy. It didn't take us too much time to get up and running. And yet, as we were into it more and more, we would find little things that we would ask about how could this make us more efficient. They clearly were like 10 steps ahead of us and had already thought that out. It was just us not knowing about that. And they were very helpful in those little details, even when we would call weeks and months after to say, is there a way to do this? Oh, it's already in there, and here it is. So that was a really great experience for us, and we continue to have that really great ongoing relationship and that support. And I really do feel like Emma is invested in us being a successful practice through using their EMR. They obviously want that to continue to go well for us, and they continue to work with us whenever we have any issues. So let me kind of walk through, I guess, our typical day in the office, if you will, with how clinics work and how we use Emma to help us. When the patient comes first to the front desk, the front office manager basically uses the desktop for much of her information, but she also uses the iPad to have them sign all the consents, the financial consents, the HIPAA forms, photo consents, etc. And so those are already all imported into the patient's chart. We don't do that as a separate paper and then scan and fax it or scan it into the note. We do it right there on the iPad, so that saves us time and effort in that direction as well. My nurse and I primarily use the iPad instead of the desktop option, and we found for us that's just most efficient. When my nurse brings the patient back to the room, she'll open a note at that point. She'll enter the vitals, the review of systems, all the other medical information. And so that when I see the patient, all of that is already imported into the chart and will automatically import it into my note. So I'll visit with the patient, whatever the issue is. And often on new consultations, I'll take the iPad in with me and click through each of the steps in those notes. And basically when I walk out, my note is almost done, other than little details I type in at the end for the assessment plan. My nurse then takes pictures after I finish that consultation, and those are then directly attached to that note that I'm about to finalize. So then once I finalize that note right from my desktop, then I already have all the fax numbers from my referring providers imported in there, and it basically has a personal note to them, attaches my note to that fax cover sheet, sends it right directly to them. And so it's an efficient use of that tool to communicate back with them. You know, many referring providers really have appreciated how quickly it allows me to communicate back with them. And for instance, I do a lot of breast reconstruction, and a lot of the breast surgeons really appreciate some of those pictures, you know, 2 weeks after the operation, or after they're finished with expansion, or after their final implants are in. They quite appreciate that. So that helps me a lot. The notes that I have used typically have the sticky feature in there, and I have written a few things in there that I like in every note when I'm talking about breast reconstruction or whatnot. But I also found that Emma has clearly put in a lot of work into each one of those tabs, because I've really found that most of that information I haven't really changed, and it's very accurate, and I like the wording, so I've really used a lot of that. Everybody's obviously concerned about the Icd-10 coding coming up, and you know, that's already built into Emma, so I don't expect that to be much of an issue when that rolls out. Again, because that communicates Emma communicating directly with our billing and coding software. You know, I expect that to be a seamless transition. So, you know, the other thing I wanted to mention, I guess, is that, you know, we have definitely given feedback to Emma and said these are the things that would help us and make us more efficient. And I really feel like that opinion is valued, and they continue to improve that product really on a, you know, daily basis. And I've even watched some of the other modules that I didn't quite know that were there, and then I popped on one and I thought, wow, that's really well written. So they continue to improve that, and I certainly appreciate that. So I guess just to really wrap up here, Emma for us was a very good decision and a very good investment. I would completely choose that again. And you know, like I'd mentioned before, it really seems rare that an EMR actually makes me more efficient, but I really feel like Emma does. And so, you know, I've really touted that to the people here in town and said I really think I've found a great one, and a lot of people have been displeased, but I would make this decision same as I always did. So that's my portion, and I appreciate y'all listening. I'll be happy to answer any questions that you might have.
Great. Thank you so much, Dr. Cash. We'll now transition to the Q&A session of tonight's webcast. Again, just a reminder, if you do have any questions, you can put them into the questions section of GoToWebinar. And our first question is, do you need a lot of computer experience to understand Emma?
I really don't think you do. Again, because it's primarily iPad based, it really is very simple. It's a touch and go kind of program, and really even asks you the questions that you're already going to ask the patient. So, for instance, if we're going through a breast reduction consultation, you're going to need to know their chest circumference. You're going to need to know their cup size. You're going to need to know what issues they've come across in the past with back pain or neck pain or rashes or whatnot. And all of that is already in there. And you literally just click the button next to that answer, and it formulates all of that for you. So it's really just a touch screen, or touching the question. So it doesn't take an incredible amount of understanding or programming ability or anything like that. And the other thing is those sticky portions of the note, for me, have been great, because there's a green check next to it, and you know that that's a sticky portion, and it'll stay with every note that you write there from that point forward in that module. And that was basically a one-time sentence I would have to write, and it's in there every time. So for me, I found it very easy to transition into.
Great. Another question here is, are the pictures you take on the iPad directly into the chart good enough quality for your website?
Great question. That's a great question. They are, actually, and that's when I first went into practice, I bought this fancy, expensive camera, and at the time, the Apple cameras weren't up to par, but now the iPads have 5 and 8 gigabyte cameras, and they're really totally adequate. In fact, all I've done now, instead of double saving those pictures, all I do is have the nurse take that picture on the iPad and imports it into Emma, and then when I want to put it on the website, I just export it out of Emma and onto the website. So for me, it's been great. It's been that's been kind of taken that whole process down to something much more simple than cataloging my own photos and the time and the difficulty that used to be.
Great. Another question, I know that you had already mentioned that you predominantly use the iPad, but this question relates to taking a note. Is it easier to complete a note on the iPad versus a PC?
For me, it is. Yeah, somehow for me it is. I like the way it looks on the iPad, and I kind of like the mobility of it. There'll be even times that I'll finish my notes as I'm sitting waiting for an operation to start, and I don't have to log in anywhere. I just have my iPad. So for me, the way it looks on the iPad is just intuitive, and so for me, it's a little easier to do on the iPad.
Great. How do you give surgical quotes? Is that through your practice management software? As I do not have a practice management software presently, so having to get a separate software is a concern of mine. Can you address that?
So for cosmetic quotes, we have most of those already formulated just based on, I don't have a OR here in the office, and I do most of mine in an outpatient surgery center. So we have those kind of pre-set up, and after I visit with the patient then visits with the office manager. The office manager gives them that quote. There is an option to put that into Emma in the exact amount that you have you've quoted the patient, but for us, we just kind of scan that into their chart and do it that way rather than do it through Emma. And I don't, you certainly don't need another billing software to do that.
Okay, great. Is there anything that you need to do to prepare for ICD-10 when using Emma?
I don't think so. It's obviously a concern because of the complex nature compared to ICD-9. But that, again, is actually a benefit of having an EMR is when let's say you're walking through a note for breast reconstruction, and you tell it where that tumor is. That's left upper outer pole invasive mammary carcinoma. All those are buttons you're going to click through with Emma and in the note, and then that will basically tell the software which code to use, and that for me seems that it actually will be a little less complex if this system continues to work as nicely as it has, because it intuitively knows what you're diagnosing.
Great. This next question kind of relates a little bit to that one. How have the coding features been for you? Do you use the super bill that it generates, and have they been accurate?
Okay, so for clinic, what we have done is, for my consultations, we just have a paper sheet where I basically click post-op and for breast reconstruction, basically, or they had a mass or surgical absence of breasts or whatever. So for that, we haven't let that run all the way through from Emma. It doesn't really generate the super bill for us. We use it through our billing and coding software. That's just how we've chosen to do it, but that's just how we kind of played out.
Okay. Is the faxing component and integrating the outside practice management system software you use, is that part of your monthly cost of using Emma, or is this an add-on cost?
Oh no, I don't think it's any extra, actually. I could be wrong on that, but I think it's all set there. It's included in our fee.
Okay. Okay. Did Emma provide you with templates, or did you have to initially write much of your content and then use it?
Most of the templates are already in there. In fact, I would say all of them are already in there. They're already pre-populated with the information, and then you can modify it as you need to. So they're really well worded in each one of the assessment and plans. So it will walk you through. Even again, a lot of what I do is breast reconstruction. So if you say basically the patient's here for a unilateral mastectomy, it then gives you surgical options, and you can click through. Well, you could do a tissue expander with a second stage implant, or you can do a latissimus with an implant, a latissimus without an implant, a tram, blah, blah, blah. Anyway, so all of that is all pre-worded as to what that operation is, and that we discussed that, and here's the risks. All that is pre-populated, and then you can modify that however you like. If you're not happy with that wording, then you can modify that however you want. And again, that's that sticky component or sticky feature that once you've written it in there or changed, modified it even in a small fashion, it'll remember that from that point forward.
Great. Another one here says, one of the biggest complaints of patients is that there is no eye contact anymore when using the EMR during the consult. Do you feel this is an issue when using Emma?
I think that I don't even know that that's related just to Emma. That's anytime you're in front of a computer and trying to type a note and be efficient as well. And for me, these notes are very simple to walk through, and I already know the questions now that Emma is basically going to guide me through. And so at this point, I can just talk to them. Initially, I would carry my iPad in and say, I'm sorry, I'm going to answer these questions kind of as we go. Is that okay with you? Obviously, most people say that that's perfectly fine. But at this point, I can bring my iPad in there, but I don't necessarily have to click through that note right as I'm talking to them. But I do like to have my iPad in there because you can draw on on a picture, for instance, you can pull up a picture of breasts, and you can draw the scars for a breast reduction or whatnot, and you save that directly into their chart. Again, that you've talked about where the scars are going to be and those kind of things. So I use it as an educational tool, and that's really at this point why I bring it in. But I don't think it interferes. I think it probably adds to my ability to educate the patient.
Great. What billing software are you integrated with?
Advanced MD. That for us was really easy. The information between the two is very seamless and really hasn't been an issue. Anytime I initially was concerned about having kind of what I'll say are two different softwares that I would have to worry about. And if I had problems with one, would one company say, well, it's really the other company's fault, and the other one say, no, it's not our fault, it's their fault. And I have found none of that. There's really not been any significant issues in the first place, but when we have said, hey, listen, something's doesn't seem like it's coming through, either something little on a patient, then the companies basically work together and get back to us. And it's not played out like the concern that I thought it would be. So for us, that was a really great choice.
Great. Does your office schedule patients through Emma, or is this done through your separate software, which in this case is Advanced MD?
It's through Advanced MD, and that hasn't been much of an issue, because when you schedule the patient through Advanced MD, all of their demographic information is imported into Emma without having to do anything. They talk to each other, and so it'll automatically import into Emma the patient's birth date, that they're male, that whatever, and their phone numbers, etc. So that's been pretty easy.
Great. This next question is in relation to support. How is the support when you have an issue, and have you ever had an issue with Emma being down? And does your office have a backup internet system?
Okay, so that anytime you're based on the internet, whenever our internet goes down, obviously that can be an issue. But we've only had that on one clinic, and that wasn't an Emma thing. That was our internet, and our backup was paper for that morning. There's no question that is a frustrating spot to be in when you're busy. But I didn't really actually. We did, in fact, call into Emma that morning and say, hey, listen, is there any problem there? And they said, no, things are working fine for us. Well, we obviously discovered it was our internet. We haven't really had any downtime with Emma. There hasn't been really a point at which we couldn't get on it, or that they crashed, or we were out in the dark there. Really, it was that issue with the internet provider. But at the same time, we could have had that if we had a local software and server-based program, we could have had an issue there too. So I think all those issues, while it's a very valid concern, kind of can be with any software program.
Great. How have you been handling new patient registrations? Do you provide the patients with an iPad to enter their information?
That's a great question. We have struggled with the most efficient way to do that. For us, we still base it on, we have them literally fill out the same piece of paper, and then I have my nurse import that information. It would be most ideal for them to go on the portal and do that ahead of time, but from our office kind of flow standpoint, we haven't figured out the most efficient way to do that. So if ideally, in my mind, the way we would do that is, the portal is the online access that the patient has to the system, right? So they can look at their notes, they can, you know, uh, find their path results, etc. Um, and they can also import their medicines, their past medical history, allergies, etc. So it would be ideal if we could figure out the most efficient way to email them or to send them in the mail their portal information before they came. They would put that in the system, and then it would already be in the chart. But we haven't figured out a way to get that done from our logistics. It doesn't mean it can't be done. It's just we haven't figured it out.
Okay. How do you do consent?
I mentioned before that, like the HIPAA, the financial consents, all that kind of stuff. For the insurance, we have already typewritten into Emma, and we have the patient use their finger to sign that on the iPad. That goes directly into their chart. And then consents for the operation are also very easy. I've made my templates for those consents. Those are very easy to put in. I mean, I actually had them on Word documents before, and then I would print them off and have the patient sign them and put them in a paper chart. I just copied and pasted those exact words into Emma, which is a very easy process. And then on the iPad, I discuss the whole thing with the patient, and then have the nurse get the consent as I'm standing there, and they sign that for a tram flap or a breast reconstruction or a facelift or whatever it is. And again, that then goes directly into their chart.
Great. When you implemented, did you do it all online, or did you have someone come in for training?
No, we did kind of what we're doing now with kind of the go-to meeting training, and with the EMR that I used right out of residency, I actually went to a course, and it was a 2-day course, and it was mind-numbing, and I didn't feel like I really had my head wrapped around it after spending basically 16 hours in a room in front of a computer. And then I was just off and launched and ready to go, supposedly. But with the training with Emma, it was serial training events spaced apart by a few days or a week or whatever, whenever it worked for our office staff and our schedule and whatnot. And we did it through this go-to meeting, and they would walk us through the notes, and I'm literally talking to the trainer. It's one trainer and our office staff, or it's one trainer and me. And I felt like it was very personal attention, and that for me was a much better way to do it than actually going somewhere or having someone try to train us as fast as they could in a very short period of time. So I shared that concern too. I initially thought, is there any other way other than having somebody come visit our office? But that for us was a much better way, and we learned much easier that way.
Great. How long did it take you and your office to become efficient with Emma?
Well, we're always still learning to be more efficient with it. I would say it probably, I mean, as far as my notes and whatnot, I felt like I could do that pretty efficiently within the first few weeks. And then as far as the logistics, I think that kind of is how everybody's office works differently together. So we initially thought, well, why don't we have the front office person try to enter the past medical history and the medicines and whatnot. Well, that didn't work very well from a flow standpoint for us, because she would actually be checking other patients in. So then we transitioned it to the nurse, and that worked out well for us. So we're kind of, I think we kind of evolve in that as we go, but we've come to the point where I think we're pretty efficient with it.
Great. Let's see here. Do you see any weaknesses other than the initial patient intake that you see with Emma, and how are they helping you with them?
It's a good question too. I think you know, I'd actually mentioned recently, I think I have to fax from the desktop. It'd be nice just it to be a pull-down menu and fax directly from my iPad. I imagine that's coming in the future. But, you know, for us, there's no glaring weakness, and I've been pretty happy with it. I can't say that there's something that would be a deal breaker for me by any means.
Okay, great. You kind of touched upon this a little bit in the beginning, but I'll go ahead and ask it in case they would like for you to elaborate. How does Emma compare to other EMRs you've seen or used?
Well, so I would say there's a few things. I think that it's important. I found you can't be everything to everybody. So I think it's important to look into an EMR that is specific to your field, because there's very detailed changes that have to happen in each field between whatever it is, orthopedics or dermatology or plastic surgery or whatever. All those are going to be a little bit different, certainly different from internal medicine and the things that they have to follow. And so with that first EMR, where basically it was trying to do that, to be everything to everybody, and then you could modify it, that was so laborious and so much work. And then ultimately lost us money because we never even filed for meaningful use. But from the get-go, with Emma, that efficiency was there. It was directed toward plastic surgery. All of the procedures that I do were already in there. There were modules in there with the wording in there appropriately. I had to make some minor modifications to them just out of me being neurotic, and then I was good to go. And then of course we applied for the first stage of meaningful use and had no trouble with that. So that was a huge cost savings for us. That's $15,000 for that first stage, and Emma helped us through that, and that was very important to us as well. So. And then I guess the other thing I would say is that from a cost standpoint, I felt like the product that they deliver is worth what I pay for it, rather than it being way overcharged for a product that that probably doesn't live up to what I'm paying for it. I think it's a very fair price.
Great. Is there a delay in pulling up previous visit notes on the iPad, or do you print them out prior to seeing a patient?
I don't print them out. In fact, I've made a very huge deal about, or very big deal about, really driving to be a almost paperless office. I don't think we'll ever get to a point where we're completely paperless, but I don't have anybody print them out but for me before. I will just pull up my note as I'm standing outside the patient's room in the 2 seconds before I walk in. The only again, it gets back to our internet provider. It's not a function of Emma or their ability to store the information or that their server is slow. Our internet provider is good most of the time, and then sometimes it's a little slow. So if you have a fast internet and you're good, then there's no delay. And I really haven't found a delay. I would just like our internet provider to be slightly faster, but that's our own issue.
Great. Back to the fax topic, do you receive your faxes in Emma?
So what we do, we have a electronic fax line that comes into one of our computers, and then the front office person basically drags that into the patient's chart, and then there's a whole section of things that I have to review, because I don't want faxes I don't want paths just to come in and it go directly into the chart without me having seen it. So I want to have to basically approve each one of those things that come through. I don't want some lab to come in, there be a potassium of 6, and me have not seen it, but it be in the chart, me not looking at it the day before or something like that, and then try to operate on the patient. So I want that system in place, and for us, the way we've done that is to have an electronic fax line that goes directly into our desktop computer. We drag that from the desktop computer into each patient's chart, and that's not a very laborious process at all. The front office person has done that very nicely, and then I go into that section into Emma and approve that basically, and then it totally imports it right into the chart.
Great. If you choose not to send pictures with your note to referring physicians, do you have the option to choose what is sent? Or if you include a picture on the note, is the whole note sent?
It's a great question. You can, when you're importing your photos, you can either choose them to automatically be attached to that note or not. And if you don't want them to automatically be attached to the note, they're in the patient's chart, but not necessarily in the note. Once they're in the note, as far as I'm aware, then you just fax it as is with the pictures. The pictures are the final page. I don't know. Maybe you can help me with that, Emily. I'm not totally sure about that option.
You do have to send the whole. Yeah, I think you do have to send the whole note.
Okay.
Yeah, you do have to send the whole note. So that appears to be the majority of all the questions that have come in. If we, for some reason, have not gotten to a question, or you would like us or Dr. Cash to elaborate on a question, you can email us at the email address that's up on the screen, info@modmed.com, and we will certainly have a Modernizing Medicine staff member contact you, or we can also reach out to Dr. Cash in elaborating further on those questions. So thank you so much, Dr. Cash, for joining us tonight. We really appreciate you sharing your experience with Emma Plastic Surgery. And this will conclude tonight's webcast. Have a great night, everyone, and thank you so much for attending.